Okay.
All right, now let's see participants. Hello, everyone. We just opened the webinar room and I can see people are coming in. It's great to see everybody here on a Wednesday. Cold, rather chilly afternoon here in Central Florida. But welcome everybody to Medicare Residency Key Considerations for Snowbirds Outside the United States. This is an educational webinar brought to you by 410 Health as part of our Lunch and Learn series. And we're absolutely thrilled to have you guys here on board today. And I'll just turn it over in a couple of moments to our expert, Wes Chapman. Wes Chapman, I give you the floor. Take it away, buddy.
Thank you very much, Ricardo. Let's wait just a couple more minutes to get people on board and get them in. I figure we'll start about 12:01, 12:02.
Perfect.
If that makes sense.
Yes, sir.
You see, does that light help matters at all?
You need to face it out more.
So I'm not more.
You raise the light.
That one
Not
back
that.
there. No, I got it. It's okay. Okay, great. My name's Wes Chapman. I'd like to welcome everybody to our second webinar of Medicare from 410 Health. A few organizational notes. We have a couple of polls today. I love to do polls and see where people's thoughts are at. I learn a lot from these polls. So if you folks can help me out and answer them during the presentation, it's really great because it lets me know what direction to take the presentation. Online with me today is our maestro of IT and all things related to presentations, Ricardo Mazzi. Ricardo lives down in Florida. I'm here in Nashville with my wife and partner, Martha Chapman. Say hi, Marty.
Hi.
And so with that, we'll get going. A few tips for working the controls today. We have chat and questions available. So please feel free to make use of both of them. These webinars are designed as a two-way learning, and actually chat kind of turns it into a network of learning. So please ask questions. You asking questions and chatting with each other, I get to see it. It does make all of us smarter. And we really appreciate your participation. Just a little bit about us. If this is your first webinar, there are four of us, all seniors. We started 410 Health because we had a tough time coming into Medicare. We had a tough time making Medicare work for us. Part of it was we really didn't know who to trust when we signed up. 410 actually means trust in Swedish. It's spelled a little bit differently, but it means trust. And we're committed to earning your trust. Part of that is these educational webinars, which we hope seniors find beneficial. 410 is all about seniors, serving seniors. It's interesting, we were going through the numbers the other day. Of the four of us, the three guys were all in healthcare, typical for Nashville. We have over 100 years of combined experience in healthcare. So we know something about it. And Martha spent many years as a teacher. And so we really rely on her to help us get the educational portion of what we do right. Residency, from my perspective, is the crux move on Medicare for snowbirds. I put this picture in here of a couple of guys climbing. It's not really a crux move. It's more of a scrambly type hike. I did a lot of rock climbing as a young man and graduated to mountaineering as an adult. Mountaineering was less physically demanding, but more fiscally demanding, actually. In the climbing world, there are one or two moves on every climb that define success versus fall. And those are crux moves. And residency really is the crux move in Medicare. And it's largely ignored. And it's particularly important. It is a particular opportunity for snowbirds. And it's one of the few things that's really to the advantage of snowbirds. And I thought I'd spend some time on it today. Medicare is a zip code dominated phenomenon. All Medicare plans, particularly Advantage plans, are geographically defined in the United States by zip code. In 2022, there were 3,834 Advantage plans in the United States. That is a lot of plans. And there was an average of 39 plans per zip code. Just as an example of how these things differ, in Nashville here, we have 58 Advantage plans available to us for next year, 27 drug plans, and 59 vendors of Plan G supplements. The Upper East Side, we spent the weekend in the Smokies with some dear friends, and they're from the Upper East Side of Manhattan. For them, there are only 7 plans, 7 G supplements available, and they're extremely expensive. There are 80 Advantage plans and 19 drug plans. In Medicare, residency really is destiny. And unlike destiny, you get to pick your own. Ricardo, here we go. Folks, if you could let me know, I only have 2 polls this week. Last week, I kind of felt I had too many polls. I had 4 or 5. But this is really, I'm trying to understand what's going on with folks here today. Do you have a permanent residency in the United States? Is it based on property that you own or rent? Do you have residency with a friend or relative? Or do you have another residency solution? All of those are correct answers. Please just let me know the one that best describes your situation. I really appreciate it because I want to get a feel for where folks are at. Looks like most folks on the call have a residence with a friend or relative. And some people don't have any residence in the United States, and that's cool. And we'll go into what that means. This is sort of a complicated decision tree, and I'm going to spend some time on this slide because it really is sort of the crux of the decision process for snowbirds. You know, on the left is the fundamental question, do I want Medicare if I'm spending an awful lot of time outside the United States? And the decision point, triangles are always a decision point in flowcharts. How often do I return to the US? Because that is one of those things that actually is going to dictate the decision process. Never. If you actually are never going to return to the United States, enjoy the expat life. If later on in life you decide to come home, you can still enroll in Part B and still get Medicare. There will be penalties. One of the problems with Medicare is living offshore does not eliminate the requirement for Part B participation. Part B, remember, is the medical care, doctors, diagnostic tests, lab tests, that kind of thing. So if you're going to move offshore and you're never coming home, you don't have to do anything. Just enjoy your life offshore. You have Part A and you can re-enroll in Part B and D if you decide to. Part B with penalties, Part D, interestingly, without. If you move offshore and declare offshore to be your residence, you will continue to have Part B penalties, but you'll have no Part D penalty. And this year, interestingly, I had a couple people who decided that they had declared themselves to be offshore. In both cases, they had maintained their Part B. They moved home and we signed them up for Part D. No penalties, no problem. Depends what you want to do. If you're not sure if you want to come back, if you're not sure what your medical care future looks like, please consider keeping Part B. Part B has 10% per year penalty associated with it. It can get pretty tough, particularly if you're gone for multiple years. Remember, this year, Part B is about $165. Last year was $170. It actually came down a little bit. If you keep your Part B, you can come home and immediately get care with original Medicare. And within between 1 and 30 days, because you can get into an Advantage plan the first of the following month. So I've said, if you come home on the first, you're going to have to wait till the first of the following month. But you've got 1 to 30 days before you're in an Advantage plan, which caps your out-of-pocket, which is important if you're sick, with no Part D or Part B penalties. If you come home occasionally, and an awful lot of the folks that we work with do, consider an Advantage plan. Advantage plans, as we discussed last week, many have good offshore urgent and emergent care coverage. Advantage plans are defined by zip code. They're maddeningly complicated. And when folks tell me, geez, I've got 1 or 2 zip codes I'm interested in, I get it. Because there is flexibility in where you establish your residence. Where you establish your residence defines what Advantage plans are available to you. It does require regular trips home, 1 or 2 trips per year. For folks that are on an Advantage plan, I really encourage coming home at least once a year. There's great screening tests. All Advantage plans are designed around the concept of managed care. Managed care depends on seeing the patient and understanding how they're doing. We'll get into it a little bit later, but telehealth, which has been around for some time, but really blossomed during the pandemic, has really changed the concept of what it means to be home. And that's something to think about. And then for folks like Martha and me, where our trips are less than 60 days, you have options. You can either have a supplement or an Advantage plan. The supplements D, G, F, M, and N, by law, all have emergency care coverage outside the United States with a lifetime cap of $50,000 with 80% indemnity style coverage. Now, in a Stump the Expert, I had a customer call up and say, what about Massachusetts? I understand that their supplements are golden, and if you have a Plan 1 or 1A in Massachusetts, then there are no limitations on how long you can be out of the country, and there are no limitations on the amount of coverage. I'd never heard of this, but the customer was exactly right. I did the research, and if you happen to live in Massachusetts, and that happens to be your residence, you're in luck, because, and if you have any of those supplements that they have in the state, which are plans 1 and 1A, they actually are good for the rest of your life, and they provide unlimited coverage for emergency care outside the United States. One of the strange little twists of Medicare. Okay. Down to the specifications of what is a residency. Well, Medicare and Social Security, remember Medicare is part of Social Security, they require a permanent mailing address in the United States. And I pulled these directly from both the Social Security and the Federal Register because I wanted folks to see exactly what it says. And down below, if you go to this subsequently, if you're on now, you can call up this presentation and go to these websites. Those are hot links. And follow this yourself. I'd encourage you to because it's an important consideration. But what is residency? Under point B there, description of U.S. residency. The best indicator of residency is a U.S. mailing address. A post office box does not work. It is a physical mailing address, and that is what constitutes residency for Social Security, for Medicare. These are the regulations. This is a direct quote from the regulations. Absence from the U.S. of less than 6 months with no intention of abandoning it. And it's one of the reasons I said on the initial slide, it really depends on how much time you intend to spend outside the United States and what you intend to do in terms of receiving your medical care. If you don't intend on abandoning U.S. residency, then being away for more than 6 months does not indicate that you've abandoned it, provided that there are some indicators that are important to Social Security and therefore for Medicare in terms of defining that, yes, even though you're out for more than 6 months, you do intend to maintain residency. It does raise a question about service area. This is very interesting because service area for Medicare Advantage plans is defined by zip code and may be limited to just a few zip codes, or it may be limited to a state. And recently we're seeing a lot of nationwide networks, so that really the service area is the United States of America. So there's a lot of complexity in terms of the plan that you pick and how it interacts with the regulations. Okay, convincing evidence of residence. This is directly from Social Security. There are about a dozen of these, and I've highlighted 5 that for most folks who haven't really moved offshore, they will continue to have some or all of these. A U.S. driver's license, it's a really good idea if you want to happen to come back to the United States and drive anywhere. A telephone directory listing. And, I saw that and I thought, how quaint, this is an old concept. And I went to the internet to check, and to my surprise and delight, the telephone directory listings in the United States are still up there. My number is a New Hampshire number, and anyone who's called me knows that. It's a 603 area code. And there is a telephone directory which lists that number at my residence here in Nashville. So yeah, telephone directory, check it out. See what you can figure out. The next group, employment, religious or fraternal organizations, that may or may not apply. But clinical cards or doctor records showing dates of visits for regular medical treatment. This is an important thing. Remember that you really need to be back at least once a year for a 12-month plan, twice a year for a 6-month plan. But clinical records of a doctor's visit include telehealth. And an awful lot of folks that I talk to offshore are using telehealth to touch base with their primary care physician and that team, and that counts as a regular medical treatment. So for a lot of reasons, the edges of these requirements get blurred, and the concept of being in or out of market also gets blurred very quickly, of the service area gets blurred. I think it's difficult to say that a person who's having regular medical treatments is out of the service area when the service area is defined as where they get the treatment. Proof of a local US bank account or check cashing card at a local establishment. I think most folks have a US bank account for maintenance of funds or a brokerage account or the like, and correspondence addressed to the claimant. Now, if you have a address to receive mail, which is the basis upon the residency, then getting mail at that address is convincing evidence. Who would have thunk it? Practical considerations about residency. You know, my grandmother used to say that you have two chances to get rich in life easily: when you're born and when you marry. Medicare offers the ability to dramatically alter your fortunes by changing the service area of your residency. You know, I encourage folks to consider where they have family and friends, where they might want to return for care, and other implications. There are a lot of things that go into it. One of the things that people need to focus on is, if they are establishing residency, they will need ultimately to come back to that point for care. And I say to folks, you know, when you're going to be coming back to the United States and you want to see where you want to go for care, that's where you want to have your residency. Place where you might have family, brothers, sisters, or children. Awful lot of folks focus on their children. Medicare is a foundational benefit. It's one of the things that I say to folks: remember, we've worked our whole lives to get Part A. We worked our whole lives, candidly, to get Part B, and we pay every month for Part B. Please take advantage of it and think about where you want to be to receive those benefits. It makes a big difference in what's available and how you receive the care in that spot. This looks like a bunch of gobbledygook, and it kind of is, and I apologize for it. But I wanted to actually give you the regulations from the Federal Register so that you can actually see what they say about disenrollment. What happens, and we'll get into this as we go through it, but the penalty for moving, if you've changed your residency, you've moved, you haven't been back for 6 months, is simply that you get disenrolled from your Advantage plan. This is a requirement of Medicare. If your Advantage plan finds that you have moved, and every case that I've seen where this has happened to a customer, it has happened because the customer told them that they had moved out of their original area of residency. Unfortunately, in some circumstances, they told them that they'd moved out of their area of residency when they still met all the criteria for being a resident. But the minute that you tell the Advantage plan that you've moved and that you're no longer a resident, they have to take it seriously. Their only solution is they send you a notice. There is an appellate process. You are then disenrolled from that Advantage plan if you don't appeal. You can see in the second section here, the basis for disenrollment is basically if you have moved out of the MA plan service area. There, as I said, there's an appellate process. The 6 month is mentioned there. And at the bottom, you can see that if you've been out for 6 months or 12 months, depending on your plan, then you're going to be disenrolled if they find out about it. Time out of the service area reminds me of the don't ask, don't tell policy of the US military in effect from 1993 till 2011, except the penalties are a lot less. In that case, you got drummed out of the service. In this case, there's an appellate process and you're disenrolled from the Advantage plan. That does not mean that you can't go back to the area and say, yes, I'm a resident and I just want to go into a different plan. You can even go back into the same plan. But it will require that you establish that you're back in residence and that you did not terminate residence, et cetera. Disenrollment happens when you move out of the area. We've talked about that. There's a special election period, and that's an important point, that if you are disenrolled, there's a special election period to re-enroll if you want. If you don't want to re-enroll, you're deemed to have elected original Medicare. That's what happens. They give you an appeal. If you don't appeal, then they give you a special election period in which to pick a new one. If you don't pick a new one, you're in original Medicare. That's hardly the worst thing that can happen, but it is exactly what happens if they find out that you have moved. They're required to do it. There are procedures and grievance policies, et cetera, when this happens. But what I wanted to emphasize is if they determine that you've moved because they find out that you've been out of market and you don't come back in and reestablish residency, then the penalty is a special election period. There's no loss of residency status, and you're still in original Medicare as default. It's not a bad outcome. Practical considerations, and this is one of the things I wanted to touch base on. How to make this work? Well, the first thing is to pick the right residency venue. You know, it's a place that you want to come back to. If you want to come back and see your kids, if you want to come back and see your family, if you want to come back because you've got business in the area, whatever it is, you do need to come back. And when you come back, you really should go see the physician, your primary care physician. I will point out that a lot of folks that I work with really don't want a primary care physician. They don't want somebody breathing down their neck. And if you get a PPO instead of an HMO, then there is no requirement for a primary care physician. And you have an awful lot of flexibility in terms of how you interact with your Advantage plan. Most Advantage plans, and it's the third point here, they typically have an obligation. You have an obligation to tell your plan if you've moved. That's an affirmative step that you take when you engage with the plan. It's okay. If you haven't moved, you have no reason to tell them. I hope at the end of this presentation, you'll know that if you have a place to receive mail, which is not a post office box, and meet at least two of those other criteria, that have no obligation to tell because your residence hasn't changed according to the rules of Social Security. You know, if they determine you've moved, they must disenroll you. There's an appellate process. It's pretty easy. If you want to stay in the same venue, you can pick a new plan. I've actually done that with people this year. It worked great. Wasn't a problem. They had made the mistake of saying they had moved when they hadn't. One important point is that claims prior to disenrollment are valid according to the terms of the plan, which is to say that you are a participant in the plan until you go through the appellate process and you're disenrolled. If you have a claim before that happens, which is typically what triggers this entire process, that claim remains valid. You are a participating member of the plan until such time as you're not. And as I said before, if you do not pick a new plan, then you remain in original Medicare. Now, Ricardo, are you back?
You betcha. Here it is.
Okay. Folks, issues of residence. I'm just trying to understand if folks understood what this was about. If you don't, give me a call, drop me a note. I'm around to help. It is a difficult subject. It is the crux move of Medicare. It is an area in which people have an awful lot of choice. The rules are pretty clear, but they're very seldom exposed. And one of the things that I wanted to do with this presentation was expose what those rules are so that folks could understand it. Okay. Great, terrific. I'm glad to see that I hope I made some difference here. That's wonderful. Great. Questions, Ricardo, we got some questions.
Oh, yes, we thank you, everybody, and keep the questions coming in. We have quite a few that we can get, so let me just go scroll down to in order. We have a lot of people, from Panama, inside the United States, Mexico. Okay, Sharon asked, our residence is with our daughter in Othello, Washington. 3 years ago, there were no Advantage plans in that area. This is why we did Plan G supplement. Now I think it is a mistake, but what if there is no Advantage plan in our area?
It's a great question. What I'd suggest is find a zip code that's close to your daughter that has them. Establish a mailing address there, which is pretty easy to do. And that way, when you go home, you can spend time with your daughter, but also at the same time get care. You've hit on one of the real problems is care in rural areas of America. We have, 58 Advantage plans here. And if you go 3 counties south, they may have 2. It's not fair, but that's the way it works. So, establish residency close to her. It doesn't have to be in the same town or in the same zip code. And if you have some questions, give me a call. We can check and find some venues that might work for you. Next question, Ricardo.
Yes, sir. The next question was, I'm living in Mexico, no Plan B. How do I get supplements without B?
Can't do it. I'm sorry, but you need to have Plan B. Excuse me, Part B. Part B is the foundation of Medicare participation. A minute on it. I don't know how long you've been without it. The penalties are 10% per year of not participating. 10% of the cost that year. So as an example, this year, if it's $165 and you didn't participate the first year you could have, the penalty would be $16.50. It goes up by 10% per year, and it can add up to a lot of money. Unfortunately, there's no way around it. If you actually spend a lot of time in Mexico, I think you may be better off with an Advantage plan, but if you're going back and forth, the supplement's great. We have supplements. I'm a big fan of supplements, but I'm also aware of their limitations.
And this,
I hope that answers the question.
Yeah, sorry. This is a similar to the previous. If you move within your service area of the supplemental plan, does this still constitute a move?
Okay, supplements are weird. They follow you. So if you have a supplement, it will go any place you move. Now, the provider of that supplement may have specific rules. As an example, I'm originally from Maine. If we were to move back to Maine, I have a plan with a carrier. I would have to reprice that plan in the Maine market. If I move to and the carrier I have actually is in all 50 states. If I move to a market where the carrier didn't have a plan, I would still have a plan. I'd just pay the rates that I paid in my old venue. So it's a little complicated. It's a little specific to the carrier. But if you have a supplement, don't worry. Now, Advantage plans are completely different. And if you move around inside the service area of a Advantage plan, no problem. If you move outside the service area or establish residence outside the service area, then you've got to look at a completely new group of plans. You know, moving is one of the special election periods. So if you move, you get a new special election period. But that's what you have to do. I did want to mention that if you don't have if you're not in Part B, and you miss your either initial enrollment period or a special enrollment period, like when you quit work and you give up your coverage at work or whatever, whatever that may be, you have to enroll in the open enrollment period between January 1st and March 31st. I would encourage doing it March 30th at the end of March, because you cannot pick an Advantage plan or supplement until July of that year. So between March 31st and July, you cannot get an Advantage plan. Actually, you could get a supplement. I misspoke on that. You could get a supplement. You could not get an Advantage plan. I hope that clears it up. Ricardo, what else we got?
Yes, Charlotte asked, and this was more so in the beginning of the presentation. What did you say after the 50,000 lifetime cap? It was something about 80% indemnity.
Right. The way it works typically is it's $50,000 and they pay 80% of it. So they'll pay 40,000 and you're in it for 10. That's the way it works. 20%, 80%.
Got it. Thank you, Charlotte. I think you also have some more questions we'll get to. James asks, is there any options for Medicare for people that do live out of the country, such as Panama?
Well, of course, you know, if you maintain a residence in the United States, and I hope it made clear today that being a permanent resident in another country doesn't mean that you cannot have a residence in the United States. I know that that's it sounds contradictory, but the United States doesn't care that someone else has said you're a permanent resident there. You could be a permanent resident there and here and be in compliance with both countries' residency requirements. They're not mutually exclusive. It is different with citizenship, of course.
Mm-hmm.
So if you do not have a residency in the United States, then unfortunately, Medicare can't do anything for you. If you have a residence in the United States, you can then you can, of course, participate. Next question.
Is there any options for Medicare for, oh, excuse me, I already answered that, my bad. We often hear about Medicare changing to easily cover expats outside the US status. Thoughts of it becoming reality, and if so, when?
Right. Excellent question. Medicare is, it's a funny thing, you know, with the stroke of a couple of pens this year, we got a $2,000 cap beginning in 24 on drug costs, which is fabulous for seniors. But the rest of Medicare has no cap. And it is the only insurance plan for health in the United States which has uncapped liability. It's nuts. This is a program in which we've paid our entire lives. We continue to pay. And we should be able to receive care offshore without jumping through hoops. I hope it happens. I'm trying to make it happen, but it hasn't happened yet.
Gotcha. Great. That's a good question. Can I get Medicare in Panama? I have no plan B and been on Medicare for 7 years, similar to the previous question.
Right. You can get with a residence establishment in the United States and the paying of Part B penalties, which if you have been on Part A for 7 years, would be a penalty of 70% of the monthly payments. Let me pull out my calculator here for a minute, just tell you how much that would be. Yeah, it'd be a penalty of $115, $116 a month. It's going to be tough. If you want it, you can get it, but it's, in your case, I'd think hard about, is this something I really need? If you go back to the States and you decide you want care there, you can always get it then.
Nancy asked, oh, well, there's a quick follow-up to that. What other options do I have?
You have the options of what's available in Panama. And that I don't actually, I don't represent. There are programs such as GeoBlue, which I do represent. And some of our customers use it quite successfully. But it also has requirements for a primary insurer. It's most effective when it's used as secondary insurance. And it does have requirements to be back in the country in order to be economic. I will say, folks, that TRICARE, if you have TRICARE, which is another federal government program, which is in part integrated with Medicare, it has it does cover offshore Medicare costs. It does, and it's unfortunate that Medicare itself doesn't do it. So if you happen to be a veteran, please take a look at TRICARE because it does a terrific job. Ricardo, what's next?
I have A and B and a supplement plan, which is very expensive. Besides residence requirements, what are advantages and disadvantages of advantage plans versus supplement?
Yeah, excellent question. I see an awful lot of folks who spend most of their time outside the United States and have supplements. And I wish that they would call me up. They don't get emergency care coverage with that plan because they're out for more than 60 days.
Mm-hmm.
They get terrific coverage if they want to come back to the United States. But for most people, they pay into it for years and don't get any benefit at all. One of the advantages of participating in an advantage plan is that it covers you outside the United States. And most of these plans today have zero premium. So routinely, I take people out of supplements and put them in advantage plans. And suddenly they're not writing that monthly check. And it adds up over the years. I will say that for folks who don't like advantage plans or don't want the intrusion that it represents, or don't want to meet the requirements that they require, you can go back to your original supplement within 12 months after trying Advantage plans. So if you want to try it out, you got 12 months to decide you like it or not. If you don't like it, you go back to what you had before. And I would really strongly recommend, particularly if you've had it for a while and it's getting expensive, trying something else.
Got it. This next question is excellent, and it goes, Dean, because of my personal medical history and my future expat plans, I think I may need to discuss my situation. Do you offer these services? How much does it cost to work with you?
Yeah. We do offer the service. We do talk to people about their medical issues all the time. Of course, we handle it in confidence. Our files are HIPAA compliant. Working with us, we're paid by the carriers. This is a retirement job for us folks. I don't charge anybody directly anything ever. That's an important part of our ethos. We get paid by the carriers if we put you in a plan. If we don't put you in a plan, we don't get paid, but that's okay. I'd much rather take care of fellow seniors and know that I'm helping people in retirement than see people get lousy information and be in the wrong plan. And so please give us a call. It doesn't cost anything. We never charge anybody anything. The carriers pay for us. And candidly, if anybody tells you that they need to be paid for Medicare advice, that is in many cases against the law. It's bad stuff. Give me a call, please.
And to add on to what Wes was saying, if you guys want to talk about your situation, the link is here in the chat here. You can book a call on your calendar at your convenience. It'll send Wes a notification saying, your calendar is booked or requested a meeting with you. Now, on the other hand, if you are ready to discuss more detail about your situation, you can always go to our website, 410health.com, click on this link takes you to the client enrollment form. And this is the HIPAA secure form that just gives you, Wes will be able to tell exactly how he can help you and recommend you if you fill out this form. So I just wanted to make sure that you guys were aware of that.
One final thing that I do want to say, kind of as we wrap things up here, is I see an awful lot of people every year who got care outside the United States, didn't bother to come home, and have had terrible problems because of it. Sepsis and in the case of oncology, death. And they ended up being vastly more expensive than they had initially anticipated, largely because of the unexpected complications.
Yeah.
If you get sick and it's major, please, please, please come back. You paid for this benefit. I know that we have a mixed reputation in the United States for the delivery of quality care, but high quality care in acute situations is one of the things the United States typically does a really good job at. So if you need care, one of the advantages of doing this is you can come home and get great care.
Yep. So Wes, before I know we're approaching the hour, more questions are coming in. This is great. Sharon, is there any confusion possible with Medicare residents and voting residents? What if they are different?
They are different. And that's an excellent question, Sharon. I wish I brought it up during the presentation. Do not conflate or confuse or confound Medicare residency requirements with voting, with tax, or with anything else. I talk to people and they say, well, but my taxes, and I go, that's okay. The IRS has its own set of regulations. The states have their own set of regulations. I mean, the state of New York, we lived in New York for 20 years and moved out when we moved to New Hampshire, and they were trying to claim me as resident for the next 5 years.
Yeah, and
They're all different.
her follow-up is, our USA residence is 3 hours drive from our normal doctor. This does not give us a problem, and we have never had a problems with our supplement plan living that far away. Is there a potential problem?
With a supplement plan, there is not. You know, I would consider, if you wanted to get an Advantage plan, to get one a little bit closer, but that's up to you.
Gotcha. Gary, I am 82. My spouse is 75. I am a U.S. federal retiree and had our health care under federal retirement. We moved to Mexico in 2018, but retained a U.S. residency. We canceled our federal health care effective 1/1 on January 1st, 2021, and did not enroll in Medicare Part B. During this concurrent enrollment period, could we now enroll in Part B and enroll in an Advantage plan? We both have pre-existing conditions.
Okay, let me take through them in reverse order. The pre-existing conditions don't matter. The sooner you do this, the better. Give me a call. Let me take a look at the special election periods. At its worst, you would need to enroll in Part B in January. The minute you enroll in Part B, I think you can buy a supplement. It may be expensive, but you can enroll in an Advantage plan, and that will take an awful lot of the cost out in July. So, you know, that's a complicated situation. The good news is, if I remember correctly, it was a 2021 disenrollment. So it won't be a terribly large penalty. Yeah, give me a call to see if we can figure this one out.
Great. I think we have time for a couple more. What type of Advantage plan can be used all over the US?
You know, there are 2 or 3 types. A lot of the major carriers now have nationwide plans. Typically, you could always use a PPO, but the advantage of the new plans is that you're in market, you're counted as in network any place you go. I really like those for our customers, and I get them wherever we can. The reason is, you know, people travel around, they want the flexibility, and they want to be in network regardless of where they are. And there are 3 or 4 of the major carriers now that do that. It's a great benefit, and I'd encourage people to look at it if at all possible.
Great. Another one came in. When can you enroll in Plan B this year?
Yeah, that's a really complicated. I'd need to know more about the particulars. If it's the initial enrollment period, anytime you want. If there's a special enrollment period and there are special enrollment periods for Plan B, I'd need to take a look at the facts and circumstances of the case. Otherwise, it would be a 1/1/23 enrollment.
Got it.
And go ahead, please.
No, that's all I have here for now. I think you have some other written ones.
Yeah. And I think I think we've covered most of them. One that I hope I covered, but it was from a person earlier this week, and I wanted to address it on the call. If I'm out for more than 6 months, do I automatically lose my coverage? And the answer is no. No, you do not. There's nothing that's automatic about losing coverage in an Advantage plan based on residency. The plan has to be told or find out that you have moved. You have an appellate period, and then you can reestablish residence or take advantage of the special election period that comes out of it, or just go back into regular Medicare, or go into regular Medicare and get a supplement. There is no limit to what you can do.
Great.
I'd like to thank everybody a lot for their time today. I hope folks have found it helpful.
Great questions.
Great questions, great team. Next week, we're going to go back to a little bit of basics. I've gotten a lot of questions recently about supplements versus Advantage. And I thought I'd do a pathways talk next week about what those two pathways are, why they're very different, what they mean for snowbirds, what they mean for people who are retired, spending a lot of time outside the United States, and how it might apply to you. So if you're interested, please tune in next week. And I look forward to talking to you then. Thank you so much. Thanks, Ricardo, for all your work. Thanks, Martha, for keeping me on track. And thanks all of you for showing up and spending an hour with us. Bye-bye.
Bye. Yeah, folks, and just a quick reminder, thank you, Wes, for a great presentation on residency. Such an important topic. You guys get in touch with us, fortin10health.com. You can click on the contact form, the number, there's a client enrollment form, and of course, you can book time with us, with Wes and the team. No strings attached, just to hear you can hear out your situation, and then you guys can take it from there. We definitely appreciate your time today, and we hope to see you next week. And thank you again for joining. We'll keep the room open for a little bit more, and then we'll shut it down. But thanks again, people. Have a
I've got a meeting with a client in 4 minutes, so I got to hop.
Well, there you go. Busy.
Okay, thanks, everybody.
Thanks.